Hello, it's nice to be with you all today to talk about the important role of health literacy as a social determinant of health that contributes to health disparities across both urban and rural American communities. Although health literacy is foundational to ensuring individuals can achieve the highest possible quality of life, it is a determinant that has been poorly measured and overlooked historically. At least that was the case up until the COVID-19 pandemic, which exposed the role of low health literacy played in the public's decreased trust in the health and public health systems, as well as the rapid spread of mis and disinformation. Health literacy is a social risk. It's associated with worse health outcomes and worse healthcare services, associated with racial and ethnic minority status, urban-rural divide, age, poverty, health insurance coverage, educational attainment, etc. And low health literacy is known to lead to individuals more likely visiting emergency rooms, having longer and more hospital stays, less likely to follow treatment plans, and having higher mortality rates. It is generally associated with a greater burden of disease. And the data back from 2003, which is the last national assessment, showed that 36% of Americans had basic to below basic health literacy. So there are a number of evidence-based strategies for enhancing an individual's health literacy, the majority of which focus on the interpersonal level of communication. It's important to remember not to put the onus for change upon the individuals and community themselves, and understand that health communications is a two-way street where the workforce and our organizations have a responsibility to meet the community's needs. So some of the strategies that we can use to improve health literacy are organizational health literacy, a newer concept, which I can describe further in our small group discussion, workforce training, including around teach-back, which is an evidence-based methodology, using plain language materials, trying to get to at least a minimum of 5th grade reading level, and then focusing on peer-to-peer health promotion, ensuring that messages are generated and disseminated by near peers and natural leaders who know and understand the cultural and linguistic needs of our communities. And community health workers are an ideal avenue for addressing health literacy because they are more than patient navigators and chronic disease managers. They are trusted and respected members of the communities at greatest risk for low health literacy and thus higher preventable morbidity and mortality. According to the Department of Labor in May 2022, over 60,000 CHWs were employed across the U.S., but I'm pretty sure that this number is an underestimate, as many CHWs remain quote-unquote uncertified. In Texas, these individuals are known as promotores de salud, or their job titles are not a CHW. Additionally, as of fall 2022, HRSA has funded over 80 community health worker training grants with the goal of increasing the workforce by 13,000 people over 3 years. All this to say that this rapidly growing workforce is ideally suited to help address health literacy challenges in the U.S., ensuring that marginalized populations have access to vital and understandable health information and services. So if our CHWs are an ideal strategy for promoting and addressing low health literacy, how can they do that? Well, one such approach is an asset-based community development model known as community health clubs. This model is simple. Club is a voluntary peer group dedicated to learning about health issues, building consensus around both the challenges and opportunities for change, and then taking action with their new knowledge. This is a health literacy strategy where trained CHWs aim to unlock and acknowledge existing community knowledge and experiences while helping members layer new information or alternative behaviors on top of existing cultures and norms. The lessons learned in the club are spread far and wide through the members themselves, using language and norms that are internal to the community, and then they leverage their social relationships to ensure everyone has access to the same information and services. Now, clubs were started in Southern Africa in the late 1990s and have since been replicated and adapted around the world, including here in South Texas in 2017. To date, over 3,500 clubs have been formed, benefiting well over 3.5 million people. And if you're interested in learning about the important role in CHW starting, facilitating, and sustaining community health clubs, please reach out to the RTTC and the Health Confianza team for more information.